Chairwoman Fox, Ranking Member Adams, and members of the subcommittee. Thank you for inviting me to testify about the work of the Office of Inspector General to strengthen accountability at CNCS. I have had the privilege of serving as the IG for nearly 4 years. Since early 2013, OIG has been recommending substantial improvements to CNCS's grants management, especially risk assessment and focused monitoring. We have identified new monitoring requirements and encouraged CNCS to begin work on them early. Our work has shown that better internal controls and risk management are needed across the organization. OIG conveys our recommendations in audit and investigation reports, in meetings with CNCS's leaders, and in briefings of the Board of Directors. We summarize them in our semi-annual reports to Congress. We have also identified other sources of help for CNCS. Following a troubling financial statement audit, we initiated discussions with OMB and CNCS to develop a plan for substantial upgrades to internal controls. We recommended an assessment of information technology and how it could better support the agency's operations and programs. CNCS responded by commissioning a report by the MITRE Corporation, which gave rise to the present IT modernization plan. To jumpstart progress, we introduced the Chief Operating Officer to the federal enterprise risk management community and its resources. We have long advocated that CNCS hire a Chief Risk Officer, whom we recently welcomed. At our suggestion, the House Committee on Government Reform requested a GAO study of grant monitoring at CNCS, which is currently in progress. To improve criminal history checking, we brought in the National Center for Missing and Exploited Children to share its expertise in assisting nonprofits. CNCS has adopted a number of our individual recommendations. There is an increased focus on accountability, and the leaders recently brought on board share that priority. But much work remains to be done on basic risk management systems. High turnover in key accountability positions, insufficient resources, and lack of trained leadership have impaired efforts to improve accountability. CNCS lacks bench strength in grant risk assessments and monitoring, creating appropriate internal controls, and identifying and reducing improper payments. The agency has repeatedly promised progress, but it continues to struggle. Its grant monitoring depends heavily on risk assessments of unproven reliability. Our preliminary review of 40 seriously troubled grants found that half had not been monitored closely because they were rated as low or medium risk. CNCS was therefore blindsided by the serious problems that occurred. Our audits and investigations also often find that the staff has missed red flags. That was the case with OIG's recent investigation of abortion-related prohibited activities. As you alluded to, Chairwoman Fox, last month, OIG reported that the National Association of Community Health Centers allowed a few AmeriCorps members to provide emotional support to women during abortions at 3 New York City clinics operated by a subgrantee. The federal statute authorizing the AmeriCorps program expressly forbids the use of AmeriCorps resources to provide abortion services or referrals for receipt of such services. Among the missed opportunities, from 2009, CNCS was on written notice that one of NAC's subgrantees was performing abortions and having AmeriCorps members provide pre-abortion assistance. The agency did not ask the identity of the subgrantee, did not determine whether the pre-abortion support activities were prohibited abortion services, and did not target NAC or the subgrantee for particular monitoring. The staff also did not record this key risk-related information in its online grants management system. Important institutional knowledge was therefore lost. The agency made a considered decision in 2009 not to provide general guidance on the meaning of the abortion prohibitions. Its first interpretive guidance was embedded in voluntary online training in 2014. There, CNCS stated for the first time that an AmeriCorps member is prohibited from accompanying a woman at a facility for an abortion, precisely what was taking place at the subgrantee. The measures that CNCS is now implementing could have been adopted long ago. These include OIG's recommendations: 1, to analyze grantees' programmatic activity and clientele in order to identify those that present a heightened risk of a particular prohibited activity. There is a greater risk of abortion-related activities at a clinic that provides women's health care than at a program for Meals on Wheels to senior citizens. Second, to expand its repertoire of monitoring activities to include more frequent direct communications with AmeriCorps members, including surveys. My staff and I see great potential to improve accountability at CNCS, and we look forward to working with the Congress and agency leaders to that important objective. Madam Chairwoman, this concludes my statement. I would be pleased to answer any questions that you or the other members might have.